Hey, y'all. Hey, welcome to the PowerWomen podcast.
This is a show where powerful women share their journeys, discuss powerful issues, and the men and women who help us rise.
And we are your hosts with three very different backgrounds and very different perspectives. I'm Brandy Jo Newman.
I'm Gayatri Agnew.
And I'm your power mom, Claire Brown. Hey, y'all. Hey, we're back again. So Gayatri's with us this week. Hello, dear. I'm so glad you're back. It's just the two of us today. Hi.
I wouldn't have missed this for the world.
I know. I love getting to talk about Lady Town. I'm so excited. And so we have Dr. Jill Jennings with us this week. Hey, Dr. Jill.
Hi.
Hi. Okay, so for those who don't know, tell us, who is Dr. Jill Jennings? Where do you work? What do you do? All the things.
Okay, first off, I am not a podcaster. Don't do this ever, but here we go.
Actually, Dr. Jill, you are. Look at you go. You're doing it.
Look at me go. I'm a podcaster right now.
Yes, you are. Yeah, it's on the resume. Add it. Yeah, you should totally put it on your social media now that you are a podcaster.
Okay. Does your name clip a uterus?
Yes.
Okay.
Yes.
So,
Dr. Jill told me they liked the elephant that I had on earlier.
And it's not an elephant.
You are killing it at this podcast biz. I'm going to let you actually introduce yourself now, but I just wanted to make sure that you had the appropriate level of confidence for the fact that you are Claire Brown's vagina doctor. And that's amazing.
She is one of my, I have a few vagina doctors. I love to share my vagina. I love to share my vagina with all my doctors. I've even shown it to my dermatologist. And so, I mean, I think it's just like an arm. I feel if we all treated it that way, it would be much more healthy.
Truthfully, it's just a body part. It's fine. Yep. And it takes a village. Yeah, it's complicated. So yes,
so
introduction. I'm Dr. Jennings. I work at the Women's Clinic here at Baptist. We're on the 12th floor of Med Towers 1.
In Little Rock,
went to Hendricks College. Oh, in Little Rock, Arkansas. Yeah, I forgot. People listen to this stuff like all over the place, right?
Yeah.
Mm-hmm. I went to Hendricks College, which is here in Arkansas. I went to the University of Arkansas for medical sciences for med school. Went to the University of Oklahoma for my OBGYN residency. And have pretty much been here at the Women's Clinic since I came home from residency. So I'm a partner now in this clinic, and we're doing big things. I just hired a nurse practitioner. She's actually sitting right beside me. But she just
nurse
started.
Practitioner.
Her name's Courtney.
Hi, Courtney.
Yeah, Courtney just started 2 days ago, and she's going to help with all this fun hormone stuff that we're doing now. But we're still doing all the old school OBGYN, delivering babies, regular gynecology, Claire's vagina, all the things.
All the lady vaginas. So I have been at this clinic now for almost 14 years because I have never been to this clinic with babies. I have only been at this clinic when I had my hysterectomy. And so, there are all types of clinics, and y'all do a lot of the baby stuff, and that's all great, good. So, but I came to the clinic for another opinion of when I was told I needed a hysterectomy at age 30. And it was like, kind of do. I mean, we'll troubleshoot and do all these things. So I talked to Dr. Burton, and he was like, you know what, Claire, I am the surgery and a baby doctor, and the sign of a great doctor is when he says, this isn't for me, and I'm going to send you to someone else. And so he did. He passed me on down the line and was like, I'm going to shuffle you on, sister. Here's Dr. Jennings. And Dr. Jennings specializes in women's hormonal health. And so I saw you. And you're like, I am here to crack the code of menopause. And I'm like, oh my God, she's my savior. She is going to save me. And you have. It's been an incredible journey. You did. You told me, you were like, in 3 months, you're going to be a whole new woman. And I am.
Good.
It's amazing. So please tell us everything that the clinic is doing, everything you are doing, and what is the vision for the future of women's hormonal health?
Well, there's a lot of things coming down the line, and some of it is like still to be determined, or we don't have, complete finalized plans, but we have big visions. And for sure, like I have, we all do hormones. That's like gynecology is hormones, but to like specialize in all these hormone changes and perimenopause and menopause is kind of a whole different thing than just prescribing a birth control pill, which is obviously a hormone. But, there's a whole nother sector that goes into it. And to be really honest, I mean, this is kind of embarrassing to admit, but like any gynecologist should and would tell you this. And I've heard other, like famous, like Mary Claire Havner. I don't know if y'all have heard of her. I mean, she's a big like TikTok gynecology menopause specialist, and she's been very vocal about this too. We're not taught in med school, and we're not taught in residency really anything about hormones except for, the basics that you need to know, and birth control and all that kind of stuff. And obviously puberty and hormones, and they're a thing. But like the changes in perimenopause and menopause is all really just ignored. It's like, how many babies can you deliver? How many surgeries can you do? Obviously, we want people to be really competent in those things. And we come out of residency overly competent in those things, I feel like. But and then it's like, well, you'll just figure this hormone stuff out later. And then you get into practice, and it is your entire practice. Everyone's coming in for their annual exam, having all of these complaints, and then, the whole like, well, this is 40. I'm sorry. That's just what we feel like as we get older. And, sorry, you're tired. You just have kids and you work, and that's just how it is. I mean, those excuses, like, don't work for people. They don't help anybody feel better. And so I kind of got sick of that being the answer. Like, well, this is just how it is. And then, I mean, I'm 43. I don't want someone to tell me like, well, you have 3 kids and you work and you take call, and I'm sorry, you just have to be tired and feel like crap for the rest of your life, So, I mean, I just got kind of tired of that being the answer. And so I just have really taken it upon myself to get further training. And I've gone to quite a bit of courses that specifically deal with hormones. I am taking in June to become a certified menopause provider through NAMS. Yeah, I know. The North American Menopause Society.
Like, it's what you're saying is it's not logical. It's not logical, but we can sort of take history into account. And once the baby's been popped out, or we've had our babies, I think in a lot of ways, like, okay, well, there you go. Right. The use has been completed.
Right. We're done with that. Now just go on and raise the babies and have a great life. Yeah.
But so I just love that you are proactively seeking out all of that training, Dr. Jennings. And the question I have, because I'm the same age as you are, and I feel like all of a sudden everyone was like, why do I feel like a crazy person? Or why can't I get up? Or why, like all these really extreme sort of physical shifts. But even once that's happening, you're already reactive as an individual, as a potential patient of yours, right? So I'm curious of this balance between reacting to a set of symptoms or potentially proactively supporting clients based on sort of age and stage of life that are starting to age into perimenopause or eventually into menopause. Like, is it still just all reactive too?
No, and that's it's so interesting that you're saying it that way, because that's what I've been telling my partners is like, as we're kind of growing this, and I hired Courtney, nurse practitioner who's it's like, I'm going to have some help, we're getting the volumes coming in, and I already had this full practice, and I'm still delivering babies. And so, we're going to have help to handle all this new volume. And then it's like, once you know this information about hormones, you can't just sit there in someone's annual while they're saying like, man, I'm so tired, or man, my hair's falling out, or what. You can't just sit there and be like, okay. I mean, or you just know like, hey, we're getting into our 40s. Our hormones are going to start changing. We need to be doing this and this and this. We need to be, making sure we have good gut health, making sure we're on the right, just like basic vitamins and things not really even prescription stuff, but just basic things of how we should be. And it's like, you can't not share that with people. You can't just kind of go and do the pap and leave. So, I mean, all of this stuff takes time, and it's like, we're going to have more dedicated help, more space, you know, and just a whole system around this. Cause at this point, it's like, I can't just be the same doctor I was 5 years ago, 10 years ago, and know all of this stuff.
Because let's be honest, there is no one else in our community, in our market. I don't know of anybody else in our state that's doing what you're doing.
I know. I mean, Kay Chandler over at Cornerstone, I respect her a lot. She's been doing this a long time. You know, she's been doing this probably 5 or 10 years. And she was really, you know, one of the first and only people. And I mean, a lot of people are like, oh, well, that's, I mean, that stuff's kind of crazy. I mean, Kay's kind of doing all this off the wall stuff. And I think, you know, maybe it seemed like that in the beginning, but now more and more people are really starting to talk about it. I mean, this has been headline Today Show. They were talking about on Good Morning America this morning, you know, putting more funding into menopause research and that kind of stuff. So it's really becoming like more mainstream stuff that people are willing to talk about. You don't seem like you're off the wall or some loony, crazy hormone lady. I mean, I feel like that's the way it was, you know, kind of 5 years ago. And I mean, Dr. Chandler's been over there, I mean, killing it, doing the things for a while. She's got like 4 nurse practitioners working with her. But I mean, she's starting to slow down. She's the Arkansas Surgeon General now. So she's busy with that and she's starting to slow down. But yeah, there's nobody, and her practice is, I mean, you can't get in to see her, you know, I mean, it is such a need. And so, yeah, there's really not anybody else doing this. And so,
let's talk about what you are doing, because there's been so much discussed about synthetics and non-synthetics and the controversy and the debate around that. And so, you know, the new thing are the pellets that have come out, and then so many providing them versus, you know, a specialist and in that area. And tell us about those products and why they are the best.
I mean, there's a lot of ways to do hormones, and I feel like, man, I could talk for like 5 hours about this stuff, but I mean,
we don't have that. We don't have that today, Dr. Jill. We don't have that.
From like back in the day, like, you know, the 70s kind of thing where everybody got put on Premarin and Prempro. Those were the big things back then. Those are synthetic conjugated hormones that are not natural. I mean, Premarin is made from pregnant horse pee, so it's not natural. There's some equine estrogens in there that are not native to the human body, obviously. So
I guess we could just go to the races and take care of our hormones.
Yeah. So that was the way that hormones used to be done. That's what the big Women's Health Initiative study was done on. So it was like these old school hormones, like nobody's using those hormones anymore. And so why are we still talking about the risk of those hormones? Because nobody's using those hormones anymore. Now we're using the kind of like token phrase is bioidentical. That just means it's identical to what your ovaries would have made. So natural estrogen, that's estradiol, natural progesterone, which is different than a progestin. That's a lab made that was combined with Premarin and made Prempro, or that's like progestins or what's in a birth control pill. But we're using, when we're talking about hormone replacement therapy, we're talking about natural estrogen, which is estradiol, and we are talking about progesterone, like micronized progesterone. And then we're talking about testosterone. So like what your ovaries make. Girls make a lot of testosterone as well. And so, yeah, pellets are one form that you can get testosterone or estradiol in a pellet. pellets are nice because you don't have to take a pill. You can't take testosterone as a pill. So really the only other ways to use testosterone are a cream that you have to put on every day. That gets kind of messy, annoying to keep up with.
Mm-hmm.
And so pellets were, a great kind of way to be able to get testosterone, but not have to use a cream. And then, there's still shots available for testosterone too, but using topical testosterone, either a cream or a pellet, you don't see the bad effects on a lipid profile. So that's important. I mean, people don't think about, well, my testosterone may make my cholesterol. I mean, people aren't thinking about the two of those together, but all of that is so intertwined with, our cardiovascular disease. And we, again, got to be thinking about that as we get older, because that's the kind of things that are ultimately, going to make us sick as we get older, is going to be all of the vascular diseases, diabetes, heart disease, Alzheimer's kind of falls in that category. It's a microvascular disease. And so how do we keep, our blood vessels healthy? And hormones play into that a lot.
Yeah.
So just how all of that goes together.
I think what you just said is so key. And I know that you and I have discussed about, so many people are pushing pellets and because, for whatever reason, what med spas and primary care physicians even. I mean, it's just, it's just insane. And it's like, wow, you specialize in this for a purpose. And it's just like, I was experiencing so many symptoms and I tried to Band-Aid that through so many different doctors and for different things. And then when I finally came to you, you did a full workup on me to then find that I had so many vitamin deficiencies. I had thyroid deficiency. I needed so many things other than just hormones, but those were all symptomatic. Those are symptoms of what my hormones were doing. And so you can't just treat the symptoms without treating the root cause. And so if you're just going and Band-Aiding wherever you are, rather than treating the whole patient, you're just going to chase your tail. And you're never going to feel good again. And so that's really, I think I have so much respect and appreciation, I think, for the way I feel. Because all of it, I know, well, I have hair again. My nails are growing good again. I have so much energy again. I feel like, doing so much. It's great. But I haven't felt this way in years.
If you just gave somebody testosterone, I mean, they're probably going to feel better. And I feel like that's kind of like, what's really kind of annoying. And I mean, I'm not trying to badmouth anybody, but there are a lot of people who really need to stay in their lane, because anybody can give somebody a pellet or give somebody some testosterone. But if you don't manage all the other stuff, then you're really not fixing somebody. And I mean, you might not get the dose right if you don't know what you're doing. There is such a thing as too much testosterone. That's not good either. So, I mean, I feel like pellets have caught on with the med spa community and maybe just other doctors that are tired of being emergency room doctors and they want to do something else. So they're now this hormone person. And I mean, I don't know. We got to kind of be careful with all that, and everybody stay in their lane, because, there are safe ways to do things and not safe ways to do. There's complications that can happen and, all of that stuff. And pellets, the problem is, and this is a bigger problem, is that there's not an FDA approved way to use testosterone in females. That doesn't mean it's not safe. We have tons of studies that show that it's safe and how we know how we can appropriately use it. But because it's not FDA approved, insurance doesn't cover it. It then becomes this cash pay kind of thing. And I think people see that and they're like, oh, it's cash pay. Well, I can do that, and it becomes sort of a money-making thing too. So I never want people to think that I'm telling them they need pellets because I'm going to make money off of pellets. I mean,
Right.
there's other ways to use testosterone too, that we might be able to, try to get their insurance, or they can use their HSA card, or, we could prescribe a male version of testosterone because male testosterone is FDA approved, and cut the dose in, a tenth of the dose and use it in a female. I mean, there's ways you can try to work your way around it, but it shouldn't be like, I can make some cash off of this, so I'm now going to offer everyone pellets.
Claire and I had some faces just on that one comment you made. So when I pick up on that, then I have another question, which was that male testosterone is approved, but not females.
Right.
I mean, it just, not intended at all to be a throwaway comment. We could do a whole other podcast, right, about how much research and how much investment has gone into male health, which is not the same as female health, because it turns out our bodies are different.
Right.
But what I wanted to ask you, Dr. Jennings, was what, like, if you go upstream, or you go before someone even comes in to see you, perhaps, or before someone even realizes they should come to see you or another specialist, what is actually happening in a woman's body around that, early 40s that's causing these changes? Because I think, Claire and I have talked about this, like, it's just not talked about. It's not like, I think more so to thank you, today's show, but like, it's menopause and perimenopause are having a moment. Good, because we need to talk about it more. But like, what is actually happening, and what are some of the things where you would say to our listeners in particular, like, if you're starting to experience this or that, like, just go see a professional versus just saying, goodness, I'm probably tired because this is happening with my kids or this is happening with work. Like, what's the difference?
Yeah. I mean, I do feel like symptom wise, like fatigue is a big one. There's lots of skin and hair changes. There's lots of like depression, anxiety, mental health type of stuff that goes on. And like, from a hormone standpoint, I mean, there's a whole bunch of different things that can happen, but from like an ovary standpoint, the biggest thing is that, we are usually not making as much progesterone in that second phase of the cycle, but we're still making a whole bunch of estrogen, sometimes even more estrogen, because as our ovaries produce less and less, our brain thinks that it needs to tell our ovaries to make even more. So then we have these little spurts where we made even more estrogen than we should have, but our progesterone's getting lower. So we're just getting more and more like out of balance. And lacking that progesterone has a lot of mental health implications with anxiety, depression, causes lots of mood changes, causes some bloating, causes our periods to be heavier, last longer than they should have. And then, the thyroid is a gland. The ovaries are a gland. So all glandular things can become less functional as we get older. That's just a phenomenon of age. And so, and the thyroid and the ovarian hormones all really work together too. So sometimes when one becomes dysfunctional, it can make the other one dysfunctional, whether that was the thyroid that broke first or the ovary, And so, you just have to sometimes kind of unwind all that. And then our insulin metabolism just plays so much into all of it. That
it's like, if you didn't have a FUPA before, you're getting one now.
That's right.
Yeah.
That's right.
It's awful. I had this brain fog to where all the time I was like, it'll come to me. I'll get back with you. I mean, to where it's like, something is like, do I have a brain tumor? Like, something is wrong with me. I need to be scanned. Like, and I know many people think that about me, but now I'm really believing them. Like, something is going on. And like, it all cleared up. Like, all of a sudden I can remember everything. Like, it's amazing. Yeah. It's all back.
Yeah. I do think, and I love, Claire, your story of self-advocacy around this and the fact that you were at a really good practice where you were receiving this advice. But I will say I have a lot of friends who I think bring up some of the issues we're talking about, either with their primary care provider or even with their gynecologist, and are literally just told, well, yeah, you're 45. Good luck.
This is 40. There's nothing to worry about it. This is 40.
I went to 2 primary cares and was dismissed. So I went a year long with this bullshit, if you will. And I went to 2 primary cares, was totally dismissed. And then I went to another doctor that, anyways. And then I can go on about, I went to 5 others. Let's just put it that way.
Yeah.
I went to 5 others.
But you persisted. I guess my question, Dr. Jennings, for you is just like, what advice would you give to folks who are receiving what they feel like is that initial sort of, who don't feel heard by.
I mean, like, if you're not yourself, like, if you've always been a, low energy, brain foggy kind of person, it's not a new thing, then, I mean, maybe that's not a big deal to you, and maybe you're fine with that or whatever. But if you don't feel like yourself and you feel like things are changing, then, and you don't feel like that you're being listened to, I mean, most of those people, some people are like, well, the doctor told me it was fine, so I guess it's fine, and I'm not going to say anything else. Yeah. I mean, a lot of people get so frustrated, they end up like at the functional medicine doctor because, the MDs won't listen to me.
So I went to functional medicine.
They told me I was fine. And here now I'm just giving up and I'm going to these alternative practice kind of people. But, which it's fine. I feel like those people have a lot to offer.
I went to a functional medicine nurse practitioner. That was one of the 5. And it was like, some of this is low. So like that was treated. And that may be your issue. So like everywhere I went, it was like, let's treat that. Let's treat this. Let's treat that.
Right.
There was a Band-Aid. Nobody looked at the whole. So it's like one person said, let's give you some vitamin B12. Let's give you some vitamin D. Let's do this. But and then one person was like, let's try you on some thyroid. Let's try you on this. But like nobody did all of it. You know what I mean? And like, I needed everything. I mean, so by the time I got to Dr. Jennings, like I was going bald. I couldn't talk. It
is sad. Like, I don't know. Cause my friends ask me the same thing. Like if they don't, they might not live here. Like I have some friends, that live in Bentonville or live in Kansas City. And they're like, wait, why isn't my doctor telling me that? Or like, why aren't they just drawing these labs automatically?
Yeah.
And there is somewhat of like, patients have to express some sort of concern. It's not like I'm just going to say, hey, you're 40 and I'm going to draw this, giant hormone panel on you. I mean, some people probably be like, perfect. Yeah, let's do it. Thank you.
Well, they also dismiss me because of my age. Because I'm 43. So I started going through this at age 40. And so they were like, you're just too young for that. You're just, And I'm like, listen, here's my family history of it. And we all start early with everything. So just get past that. And this is not who I am. And and to your point, Gayatri, yes, I was persistent, but we know that I'm a little bit of a persistent person. And so I don't like to hear the word no really well. It does not go over well.
We do know you're a little bit persistent.
Yeah. So, you know how you feel, you know what your symptoms are, you know what your normal was, you know how you used to feel. So if you're being dismissed, find another doctor, talk to your friends, see who they went to, just keep going. Be clear about it. Like be
clear about it.
Yeah.
I love that.
Be clear.
And then, and then Dr. Jennings, obviously individuals should be persistent, but what about the system itself? Like how do you think we see this change over time? What do you want to see change? What are you advocating to see change so that more women are better served?
So, we're doing better all together. We're talking about it on the Today Show. We're talking about it on Good Morning America. We're talking about it on this podcast. So it's definitely being talked about more. But I think until like people are coming out of med school being taught this, because I think that is where the biggest problem is. We're graduating doctors who, okay, you're a doctor, everything now. And, you can't learn anything new now that you've graduated from med school, all of the things. And so I feel like that's the problem is nobody wants to go back and expand on their knowledge. And so until we come out of med school kind of knowing that this is a thing and needs attention. And so that's where we're going. That's what I want to try to do next. I'm already working with residents. I have family medicine residents that rotate through with me, and I'm trying to teach them what I can about hormones, like just not that they need to be able to treat those people, but hey, just so you know, when women come in with these complaints, do not dismiss them. Like,
Right.
send them to me. If you don't know what to do, that's okay. Send them to someone who does. Don't dismiss people. And like, I mean, I want to go down the street to the med school and, you know, start teaching them that as well, because I feel like they're still teaching the Women's Health Initiative data from 20 years ago that has been well refuted.
Yes, ma'am.
And so we need to stop doing that. I mean, we're not teaching 20-year-old things about cholesterol or diabetes. And so we've got to do better from a med school standpoint.
I love that.
I do too.
Dr. Jennings,
ma'am.
make it happen. We'll help you. I love it.
Thank you so much for your
We need it.
time,
Yes,
Dr.
please.
Jennings. I know how valuable it is. And I so love how many lives you're changing. Yes. And I mean, it's just like I said to you, I'm like,
so
you know, I'm not
excited
getting
about it.
Me too. It's like I told you, I was like, if I'm not getting laid, it's a medical issue. And so ladies, if you're not making it happen, it's a medical problem. You need to focus on yourself. So thank you for changing the world.
Yeah.
Yeah.
Thank you, Dr. Jennings.
Thank y'all.
Have a great day. Thank you so much for listening. If you like the show, please rate and review on iTunes and check out our website, thepowerwomen.org.